Medical professionals of Reddit, when did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad, or of that nature? Not medical professionals, but we were the patients. My daughter, who was 3 at the time, had to have a cavity filled. As we were leaving, the dentist told me just to watch my daughter because sometimes kids chew their gums because it's numb and feels weird. So the drive home took 30 minutes and I had been talking to my daughter the entire time to keep her busy. I park my car in my driveway, opened the passenger seat to get my daughter out, and her entire lower lip on the left side is gone. She had chewed it off down to her chin. She ended up in emergency surgery, but the surgeon kept telling us it would be fine and he sees this stuff all the time. She ended up having multiple surgeries, and when she was finally healed, the surgeon told us that it was the worst injury like that he had ever seen. He wasn't sure how she would heal, but you can hardly tell it happened now. 5 years ago I spent 6 months working in a small rural Zambian hospital in the medical ward as part of a volunteer outreach program. I have done mostly family medicine, some surgery in my early days, but decided to mix life up a bit. The hospital was typical third world, a few basic medications, rudimentary clinical tools, a small lab on site which was usually broken. No resuscitation tools whatsoever. HIV, TB and malaria was rife. It would not be uncommon to encounter a death per day despite our best efforts. On one of my first days there, an unconscious person was carried in by a mob of locals. I could smell him before I saw him because he had been in a house fire and his skin was cooked completely black around his chest, face and over his legs. He was still breathing on his own and maintaining his airway, but we had no doubt he had inhaled a lot of smoke. With no way to intubate or provide oxygen, we merely had to hope that he didn't swell up and close off, and deal with the rest of the burns while he was unconscious. 2 colleagues who worked in the hospital came over urgently. We all kept our cool externally and got the nurses to translate to the man's family that we were going to do everything we could to get him better. In reality, all 3 of us knew his chances at survival were in the single-digit percentages. We decided that due to the extent of his burns we were going to have to do an escherectomy, cutting the burnt skin to prevent it contracting and stopping him from breathing. Turns out I had the most surgical experience, so despite having never done one before I gave it a go, hoping for the best. We got an IV into a neck vein and got fluids going. The local nurses dressed his burns. We gave him whatever pain relief we had. He was unconscious for a couple of days but eventually came to. Each day we were expecting his kidneys to pack up, but to our surprise, gradually he got better. He was with us for just over 4 months recovering. He came out severely scarred, but he had beaten the odds and survived. Probably too late to the party, but I had a lady come into the ER listed as multiple medical problems. This usually means diabetes and the issues stemming from it, or maybe bleeding issues from another disease, or maybe odd blood tests results at a clinic. I hadn't seen the patient yet, but the DR came to the nurse's station asking who had room 15. I jumped up and followed him into the room. I walked in and saw what I thought was a corpse. Then the patient's eye swiveled over to look at me. She truly looked like one of the people they found in a concentration camp. I could see every bone and her body was twisted in a decorticate position with her jaw locked open. Then the smell hit me, rotting flesh, death, and body fluids. I struggled to keep a neutral face and not gag. I tried to place a blood pressure cuff on her arm and her skin just started flaking off in my hands. I gagged. The DR started removing her clothes to examine her. Her feet were black to the ankles. Her hip bones were poking through her skin and were black. The skin around her ribs was worn away, oozing muscle fibers. Her calves were incredibly swollen and the skin was splitting like ripped pants. I removed her depends, and there was feces coating her entire genital area. Then the DR went to remove a large bandage on her lower back. Her entire sacrum was exposed and the bones were black. The skin around it was a black liquefied mass. It smelled like nothing I've ever smelled. I can't even describe it. The doctor told her family I would clean up her ulcers and wounds in preparation for surgery. No surgeon would operate on her. I had no idea how to clean dead bone tissue and liquefied skin. They don't cover that in nursing school. When I went to clean her sacral area, all the liquefied skin separated and oozed all over the bed. I really struggled to keep my shit together. Afterwards, I needed a moment in the supply closet to cry it out for a second. I had no idea the human body could break down so much without dying. I still think about that woman sometimes and what led to her living like that. It still breaks my heart. I'm a nurse and I work in a pediatric ER. A young woman brought her baby in to be seen for vomiting. I ask her to put the baby on the scale. While on the scale I notice a strong odor of bug spray, so I asked about it. Mom, a roach crawled into her mouth, so I sprayed a little Raid in there. She said it matter of factually like it was no big deal. Cup calls to the police, CPS and a 1-1 sitter for the child and the mom. When all was said and done, the baby was fine and turned over to her grandmother, so no worries there. I have no idea what happened to the mother. I don't believe she was intending to hurt the child. I think she was just butt-ass ignorant. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after someone left-turned without checking. He had gone over the hood, slid and somehow somersaulted, landing on his ass sitting up. He slid across intersection mostly on his ass, getting serious road rash. Luckily he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and ass, when all of a sudden, his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his ass. The attending pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal and dry heaved. Edit. Thank you for my first gold. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me, he just wanted to check. It was just, well, not to queue jump or anything, but he wanted to check, can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat and I'd make sure someone was with him right away. Why hello there. Thanks for watching. Be sure to like and subscribe for more weekly videos. See you next time.